Established as an educational, training, and family life planning institution, the Guyana Responsible Parenthood Association opened its doors in 1973 as a proud non-governmental organization.
The organization was founded by quite an established woman, Olga Millicent Byrne. Ms. Byrne was able to establish an organization which was well positioned and with a good strategy to be able to make a significant contribution to Guyana. The association actually was formed as a part of women's move to establish their rights as full citizens in the country and to be able to participate in the life of the society. So you can understand that family planning was very important for women to be able to decide on their reproductive health and that they'd be able to have control over their family, number of children, spacing of children, their health and well-being.
Since that time, the organization has rapidly evolved, expanding its scope and developing a more holistic approach to sexual and reproductive health.
It is the organization that has survived over time. We're going right back to 1970 something and we're now in 2015. And GRPA has been able to stay the course.
We have been able to be accredited by the International Planned Parenthood Federation. We have achieved consultative status with the UN as an NGO. We are one of the associate member of the Caribbean Family Planning Association. We have been recognized not only locally, regionally, but internationally.
As a member of the International Planned Parenthood Federation, the GRPA is part of a global movement which addresses sexual and reproductive health. The performance of our members is really what contributes to the success of the IPPF, and we are really proud to count the GRPA as one of our members because of the quality of its work over the last 15 years. The performance of the GRPA makes it important not only to Guyana, but to the Caribbean as a whole, because they are emerging as a leader in family planning and in sexual health across the sub-region of the Caribbean.
GRPA over the years just got better as it went along. The dynamics change, changing times, changing circumstances. But that was a major plus for the organization.
It certainly has evolved in terms of the services it's offering. I mean, the last major project that was launched 2 years ago was the VIA screening, which targeted a significant areas in the Amerindian communities. And that itself was an eye-opener for all of us when we saw the results of the screening. They recently launched a program called Choices, which is targeting youths and choices you have to make. So there's a significant amount of programs in the next 2 to 3 years that we're looking forward to that really could make a difference in the lives of young people in this country.
A subsequent organization, the Guyana Family Planning Association, has now founded Prudent to integrate itself into GRPAs.
I'd like to think that the merger benefited GRPA in that staff, trained and capable staff from Family Planning Association were absorbed or became part of Guyana Responsible Parenthood Association. Their clients as well came over, and so I think GRPA stands today a much stronger organization as a result of that merger.
GRPA has gained recognition and respect for the quality of services it provides in a safe and comfortable environment.
We'll do general gynecological patient, we do pap smear, we do VIA, whether they come for counseling in anything like probably contraceptive, counseling in STIs, medical termination, or the manual evacuation. Those are all abortion methods. We counsel in that field.
The service is pretty much excellent. It's up there. They're very, very confidential, for sure. I could tell you that one.
The service is very good, and you maintain confidentiality and privacy, which is what I think people are looking for if they want to access a service. And once those core values are there, that is something that would make you want to come again to access the service of the organization.
We have the clinic for infertility. We're working hard with this kind of woman. We getting all for different places for this country. Woman that long time tried to get pregnant, and we're working with this kind of woman very hard. We have tests. We treat this woman, and we see some results.
She came to the clinic and our doctor treated her. Eventually, she got pregnant. And now she had delivered a healthy baby girl.
When we do the contraceptive, we won't pay the full price that we pay at the private clinic. We will pay just a half price, which is very good for us.
GRPA supports youth advocacy movements that champion the empowerment of youth through information, education, and services on issues pertaining to their sexual and reproductive health and other family life issues.
It is an adolescent, youth-friendly organization which does not discriminate against young people, which does not have any challenges working with young people. Hence, it reaches out to adolescents and youth. It has a specific program for adolescents and youth, encouraging them to access information and services on sexual and reproductive health and sexuality education.
I love doing outreach activities at the GRPA. It's the greatest thing to know. When you go out, you get to meet other people, and sometimes you get to play a little role in their lives and impact them so that they can make a change, a healthy change, make a decision to come into us and access our services. And that's the best part of being a part of the GRPA.
Being a part of YAM, have become more comfortable. You know, I use this as an opportunity to step out of my comfort zone, and now I'm glad for the opportunity where I can not only promote youth advocacy and youth empowerment, but also even to the extent now where I can promote sexual health and family life in peer education sessions, in facilitation sessions, and in advocacy sessions as well.
When I first came to YAM, I hadn't any idea of what was sexual education or sexual rights for individuals, because first of all, I wasn't taught about it at home. So I really came here to learn about that aspect of life. And what the YAM really brings to the fore, what it brings to young people, are opportunities to be educated, to come to socialize with young people, to be aware of issues pertaining to youth, and to also learn life skills as it pertains to leadership. Like my role in the YAM, I'm a part of the leadership team, and my focus is really communication and getting the message out there on social media about our purpose and what we do, our mandate.
The focus has always been the young people, which is good. Give them that space where they feel comfortable to speak and give great leadership roles, providing them the opportunities to interact with persons at the international level, and that's also important for them.
Personally, it would have benefited me in such a way that I would have gotten the opportunity to have various trainings in relation to different topics in terms of sexual and reproductive health. A lot of them would have been overseas. In 2005, I was sent to Trinidad on an HIV awareness and care program, where we would have received an international certificate from IPPF. 2008, I went to St. Martin's and Mexico. Mexico was for an HIV conference. St. Martin's was a sexual diversity workshop. Also, I would have done a lot of work within Guyana too with GRPA and YAM, going to various schools, various organizations, and carrying on workshops and training.
GRPA has recognized the importance of providing services and including intentionally the LGBTI community. They comprise some of the most vulnerable sections of the population. They face discrimination at many levels, including in the health sector.
The association is also involved in community outreach programs and focus group discussions on gender-based violence and sexual rights.
Thanks to GRPA for doing this great service what they're doing, and I hope they continue to come in more often to educate us in St. Cuthbert's mission, and it's great.
The challenge GRPA has is mobilization of resources for the work it wishes to do.
Funding is the biggest challenge because we get funding through the main funding agency is IPPF, International Planned Parenthood Federation, and we get a small funding from a subvention from the government of Guyana. We also get some income, local income through the clinic and the pharmacy. However, sometimes that is not sufficient to run the organization.
The organization needs strengthening. I think they need a lot more human resources. It's a pretty small organization, and for them to do the kind of work that is required of them as a sister organization, a partner organization to the Ministry of Health, they need to build that strength, they need to build the capacity, they need a lot more resources, financial resources, so they can reach out to the hinterland and rural communities.
At GRPA, we understand that sexual and reproductive health and access to services that strengthen the family unit are key to ensuring that the population remains healthy and productive.
One of the sad realities of our nation today is that we still see family planning as something not to talk about. We still see pregnancy as something that just seems to happen to us. I would really like GRPA to play a role in raising awareness that family planning is something that everybody should be involved in. Everybody who is sexually active should be involved in. And this includes even women who are already married, settled, but she has a right and should, with her partner, plan her family, plan how many children she can afford, plan the spacing of the children.
The organization strives to provide holistic care for persons. The individual is very important to us. We have a rights-based approach to health care. So when a person comes to GRPA, counseling is mandatory. We do counseling and education. Counseling can be extended beyond the medical situation into a deeper level of encounter if the person so desires, because we have a programs department whereby a person who walks into our clinic may also have a whole host of other issues they're dealing with. Here is where we strive to be able to meet people and these needs, which are quite important and necessary in the society.
The Guyana Responsible Parenthood Association remains committed to working with its partners to ensure families and the country at large continue to benefit from the vital services provided by the facility.
We would also like to partner with other organizations, non-governmental organizations, civil society, businesses, to carry our services to workplaces and to educate.
we need to do much more than when it becomes an urgent issue and we need a kind of emergency care. We still are not serving the Amerindian community in a significant way. I mean, ad hoc here and there when we have funds because of how expensive it is. But we are aiming to reach the hinterland communities because healthcare, and for instance, the percentage of persons with cervical cancer women, these are highest rates in the hinterland areas.
There's so much that GRPA is poised to do and has already started to do. And I think with the right support and resources, we can do so much more. We're in schools, we're reaching youths out of schools. But if we can get to more schools in terms of being able to have our education programs where we raise awareness about your body, about your rights, sexual rights, your reproductive rights, your health, also women and pregnancy. We manage pregnancies, the uncomplicated pregnancies. Women can come here to have their whole pregnancy monitored.
As they evolve and they become more relevant, because that's what evolution is about, I just wish them all the very best and hope that they can continue to touch the lives of young people, make that overarching reach for the young men, continue to do that, and all goes well for the future.
I wish this organization all the very best. I'm going to do my part to help it to grow. I know I speak for the entire board when I say that we're there for GRPA and we intend to see it grow as we venture out to take the services to the people.